Hello and welcome to Evaluation Matrix in ThriveHub. In this video, we will explore ThriveHub's evaluation matrix and how it can be helpful to you and your organization. Let's dive in. So, what is evaluation matrix? Excellent question. Evaluation matrix is a social determinants of health assessment tool. It can be used at a single point in time to assess the needs of someone or over a period of time to assess progress. Counselors can complete an evaluation for a client, or a client also has the ability to complete a self-evaluation. Starting an evaluation is easy. We will go through how clients can start a self-evaluation and then how counselors can start an evaluation for a client. There are several ways to start a self-evaluation, but choose the one that's easiest for you. You can start a self-evaluation from the home page, through the quick actions, or through the eval matrix option in the crossover menu. Before we dive in, we'll also show you how to start an evaluation for a client. The process is much the same to start an evaluation for a client. First, make sure you're in your organization workspace. Now, you can start an evaluation from the home page, through the quick actions, through the actions button on the client tab, or through the eval matrix option on the crossover menu. Today, we'll use the eval matrix option in the crossover menu. To start a new evaluation, click the Click Here to Begin link. If you're doing an evaluation for a client, you will have to select a client before you can proceed. For a self-evaluation, you will not need to select yourself. You have a choice of 22 different categories of social determinants of health. Let's talk about the categories. Behavioral intervention focuses on specific traits or behaviors that may affect daily functioning. Case management deals with a client's involvement and engagement in their case management. Disability addresses any disabilities a client may have. Children pertains to questions about childcare. Employment concerns a client's employment status. Education relates to a client's level of education. Family reunification explores family support and related situations. Finances covers income and budgeting matters. Food insecurity examines the ability to afford healthy and fresh foods. Housing inquires about a client's living situation, including rent or mortgage. Legal touches upon involvement with the justice system. Community involvement or pro-social engagement asks about community connections. Mental health addresses mental health symptoms. Substance abuse explores substance use by the client. Transportation looks at a client's access to transportation. Language and literacy examines communication barriers for clients whose first language isn't English. Discrimination focuses on how experiences with discrimination might affect the client. Access to healthcare explores a client's ability to access healthcare. Health literacy inquires about a client's understanding of their medical diagnosis. Experiences with trauma addresses how past trauma may impact the client. Environment and neighborhood asks about the client's neighborhood. Quality of housing explores the client's living situation and its quality. These categories help us gather valuable information to better understand and support our clients. After you have selected your categories, click Start Evaluation. For each category you select, you will choose a number from 0 to 5 that best describes the situation. 0 is in crisis. 1 is near crisis. 2 is below expectations. 3 is meets expectations. 4 is exceeds expectations. And 5 is highly exceeds expectations. For each number, there is corresponding information based on the category to help you determine which is the best fit. To the right of the scale, there are 4 different next steps options for each category. There are options to add a note, add a task, find services, and recommendations. Add a note will add a note to the client's account. This note can be for you, for other caseworkers, or for the client. The note will automatically be tagged with the Social Determinant of Health category listed. These notes can then be found in Collab tools. Add a task will add a new task to your client's task list. This will automatically tag the client and the Social Determinant of Health category. Enter the title task, confirm the assignee, the due dates, and add a description of the task. You can tag the tasks for programs as well. In the More Options section, you can attach a form, search for a meeting room, add a flag and a priority, and add to a plan. Find Services will help you find services for the category listed. You can search by zip code or by city to find services near you. When you find a service that you might be interested in, click Add to Task List so you don't forget to follow up. Recommendations lists several options to find help with the category listed. You can click Add to Task List on these items as well. After you've completed your evaluation, click Save. If you're doing a self-evaluation, you're done. You can view any items assigned to you from your task list on the home page in the Tasks section, or by navigating to Task List on the crossover menu. If you're doing an evaluation for a client, it will take you back to this Evaluation Matrix section. In this section, you will also be able to see other evaluations done at your organization. For clients who have completed multiple evaluations, you will be able to see past and current evaluations. For each client, there will be an Actions button with 4 options. These options are View Next Steps, Track Evaluation, Archive Evaluation, and Edit Evaluation. For View Next Steps, you can find all of the next steps that you set up during the assessment. You can update the progress on each of these tasks by using the progress icon or by posting a note as a reply to remind the client or provide additional information. On Track Evaluation, you can see evaluation progress over time or export an evaluation summary. Archive Evaluation will remove the evaluation from your organization workspace. You won't be able to bring it back, so only archive evaluations that need to be removed. Edit Evaluation will take you back to the evaluation to make any changes or updates needed. Remember, this is editing a submitted evaluation. If you need to start a new evaluation, use the Click Here button to start a brand new one. In this video, we have covered Evaluation Matrix and the ways you can use this feature in ThriveHub. We hope you enjoyed this video. If you have any questions, comments, or feedback, please reach out to SC Thrive. Thank you for joining us and welcome to our community. Until next time.